As I know already, thank you so much for having me. Hi, how are you? Evan. My goal today is to have you guys become biologists.
And I want to degree after we get done.
Yeah, there's a test afterwards.
That's good.
I want to be able to educate you guys on your health, and I wanted this to be done in a very short amount of time because I know that most of us don't have the attention span of more than 20 minutes.
Oh,
Right?
yeah.
So-
Speak for yourself.
So, I am personally speaking for myself. So my goal today is to get a couple people up here and do demonstrations on how we assess for instability, gait problems, as well as learning more about that stuff, right? So most of my mature population, for lack of better terms, they're mostly concerned about falling. Who in this room would be concerned about falling typically? Probably everybody. And worse than falling is breaking a hip.
If they have drinks in them, no.
If they drink, it's probably better,
That's
right?
even better. I would know it.
Because when we fall, we typically have a secondary injury, like a hip fracture. And those secondary injuries are the injuries we don't want to have happen. Because as we age, when we get a hip fracture, then it leads to other complications, most likely in a hospital setting. So we want to try to prevent the fall from happening to begin with, right? So there's a few things that we do in physical therapy, as well as acupuncture, to help you improve your balance, agility, and coordination. Now, who's ever been a baby before? Who's ever been a baby?
Everybody's going to say it.
Okay, all right. Who wishes they were still a baby, right? Right? All right. Who has grandchildren or great-grandchildren? All right. So if you think about how a baby develops, do they stand up and come out of the womb immediately and they walk around like a deer gets when the deer gets birth? No, right? So there's specific reflexes that occur when a baby is born, right? And the first reflex is E5, they want to breathe. That's a foundational reflex that occurs in the human species. And then they start learning to maybe grasp for things and maybe roll and then line the neurodevelopmental sequences that must occur in order for us to actually walk and survive in normal human life. Now what's interesting is this. As we age, we actually regress a little bit. Those primitive reflexes don't work as well as they used to. Now I'm not saying that I'm going to get you on the floor and have you crawl. Because I do that with but you'd be surprised what I do in my clinics and stuff. But we can do that, but not for your population. I'm not going to get you on the ground and have you crawl to activate these primitive reflexes. But what I might do is I might actually have you do some eye exercises. Or I might have you walk barefoot. Because these reflexes start at the feet. So if you think about it, who's ever worn gloves in your hands and tried to pick things up? Right?
A lot of people.
A lot of people. And do you feel as good?
No.
No, the sensation, because you have gloves on your hands. Now, can you imagine your feet? We're always wearing gloves on our feet, and those are called shoes or even socks. And there's 200,000 skin receptors in our feet. Receptors are like, where am I in space? So if I touch your arm, how do you know I'm touching you? Because of the receptors in the skin. Okay? All right, and that's called proprioception. We have a lot of them in our feet. 200,000 of them in our feet. So our feet give us an idea of where we are in space. Now, if you can imagine, if we're in shoes or socks all the time, what's going to happen to our balance? It's going to be off. We do in our clinic, we get you barefoot. We test certain reflexes to see how the body is responding. I'll do some testing today on one person we'll probably have time for. But it's very important for us to understand that balance, posture, and stability start at the feet, the eyes, and our jaw. Wait, my jaw? Yeah. Yeah. So if you think about this, when we're up and we're walking, when you're feeling on really short steps, or do you think your eyes are up and you're like, hey man, how you doing, right? That's because our eyes drive the body. So if our head goes down, if the eyes go down, the head follows. As our eyes go down, what do you think happens to our ability to see in different angles, different positions? It becomes compromised.
Your perspective is right.
Everything. Now imagine wearing shoes all the time, having gloves on your feet all the time. Guess what's happening to your balance and agility? It gets off. And then guess what happens to those reflexes that we talked about, these primitive reflexes that we talked about? They become dysfunctional. All right? So all we do in physical therapy is assess what I call the big rocks in your backpack. Now I believe there's one reason why people have posture and gait instability or pain, doesn't matter what you call it, whatever you label it, and that's called stress. But two types of stressors. One is called traumatic stressors, and posture, or postural trauma is very common. And in physical therapy, we focus on the trauma, or the posture, I should say, or the bad posture mechanics that we might have. Also emotional trauma. Who's ever here lost a loved one? By everybody in this room. When you live long enough, you lose somebody that you love. Those emotional traumas get stored in our brain. And it affects our ability for our musculoskeletal system to function. So our muscles and our joints and our body to be able to function when we have stress over time. And then the second reason, so we talked about trauma, the second reason is terrain. That's our foods we eat. So there's certain foods that we eat that are really inflammatory to not only our joints, but also to our brain and nervous system.
You said terrain?
Terrain.
T-E-R-R-A-I-N?
The soil of the body. Okay. So for all delicate flowers in here, like me, and we want to bloom, we need water, sunlight, and oxygen above the soil. But in the soil, we need proper minerals and enzymes and bacteria. We want to make sure there's no heavy metal or toxic chemical coming into the soil. That's going to affect the plant from growing. And our nervous system relies on omega-3s from fish oils, magnesium, our nervous system requires, retinol, which is vitamin A, right? These are really important substances the body needs in order for the nervous system to function. Remember those 200,000 receptors in the feet?
Yeah.
Right? So being barefoot, fixing the eyes, getting on a good nutritional support protocol will help build neurological function. And that's all we do in physical therapy. That's all we do in acupuncture as well. Make sense?
Absolutely. We'll get rid of our shoes as soon as we leave.
I don't want you doing that
Hey,
yet.
tell us about walking backward helps you.
Walking backward would help you if you don't have gait and stability.
That's right.
You don't want to walk backwards or be barefoot until you have somebody that's trained to coach you so you build tolerance over time. I'm not saying go barefoot today and walk around. That's not what I'm saying. I'm saying when you enter a controlled environment like kinetic physical therapy, we'll get you barefoot, train you barefoot so that when you come back to your living quarters, you can walk around barefoot in your room and you feel comfortable with that. That you would do, that's great.
You know why? She don't want to watch your socks.
Can I borrow a volunteer? Can I borrow you for a second? Do you mind taking your shoes and socks off?
Oh.
Do you mind just taking the shoes off? Okay. While she's doing that. Okay. Yes, ma'am?
I walk barefoot at all times. The minute I walk into my place, I take off my shoes. And I don't wear stockings.
Good
So
job.
I walk at all times barefoot
I love you.
because it helps my balance.
I love you.
Yeah.
It does.
How about all the stuff you read? It tells you not to walk around your room barefoot and all that stuff.
Well, think about around your room. You mean in your environment?
Yeah.
In your environment, I want you to have your shoes on unless you're conditioned by a PT.
Okay.
Okay, so let's do some diagnostics here. I'm sorry, what's your first name again?
Mary.
Hi, Mary. Let's have you take a seat for me. All right, face everybody. So I want to check a couple reflexes on her. All right, now this is gonna be fun. Can I borrow your foot and relax? All right. Let me just see this for a second. And you did good. Good job.
She didn't say
Relax your
ouch.
foot. Relax your toe. Good. So that's very good. I'm very happy with that. You did so good.
Wiggle.
Yeah. So we passed that test. Now what I want you to do from here is I want you to focus on my finger. And now I'm looking at the ability for her eye to track. Now, when I bring her eyes together, her left eye comes in, right eye does not move. So if the right eye doesn't converge or go in like this, think about this. If I'm looking straight ahead and I'm walking towards an object, and this eye goes that way, but this eye tracks, what's going to happen to gait? What's going to happen to your balance and stability?
It's going to be off.
It's going to be off.
Yeah.
And then what's going to happen to the postural muscles,
Gonna be off too.
like the neck, the back, the hips, etc.? They're going to go into spasm, they're going to tighten up. It's going to be a reflex that's going to cause muscular tightness. So the eye is not tracking appropriately could cause a cascade of effects in the body. Okay, so that's number one. Ready? Now I'm going to be stand up. Now, can you put your feet together for me? And now close your eyes for me. Okay, so open. All right, take a seat now. All right, so what I'm looking at now is I'm looking at the ability for the brain to function very well. I'm looking at left, right side comparison. So the moment she stood up and closed her eyes, she fell or leaned or swayed to her left. Okay? So think about this. If I'm walking straight, really, she's walking to her left the whole entire time.
So she keep her eyes open all the time then.
And that's probably why the eye's not tracking very well. And 80% of us in this room, they track to the left. We fall to our left. 20% go to the right.
Why is that so?
I don't know.
Don't make any sense though, right?
You know, honestly, it does make sense because if you think about it, if the right brain is not working as well as the left brain, think about society now. The left brain is very analytical and is very judgmental, right? It's more involved in intelligence, IQ intelligence, where the right brain is more community-based, more spatial-based, more emotional intelligence, more family-oriented, less judgmental. And think about society nowadays. We're more driven towards more judgmenting people or being judgmental of people, more criticizing people. It's just how society is right now, unfortunately. Where our ancestors, we're part of a tribe. And we'd all had a job in our tribe, right? So I think that's one of the things that's missing in today's culture, unfortunately.
Is the left brain his creative side?
The right brain is creative side.
That's what I said yesterday.
Yeah.
My
Yeah, left brain is more language, right brain is more creative, artistic. So a way to activate the right brain is music, is dancing, is being artistic. Those are different ways to activate that brain. Okay? Now, going back to this, she was falling to the left. So she's going to have to compensate by probably sticking her right leg out a little wider. Guess what's happening to her back?
Throwing it out.
So these are common compensations that don't have to be there. But if we don't retrain the brain, no matter as many exercises we give her, it's not going to fix the problem. So we're going to retrain the brain. That's how kinetic, we're totally different than most clinics, is because we try to work on reflexes that are causing the imbalance, not trying to fix the imbalance. We're going to get to the root. And in Chinese medicine, to treat disease, we must treat the root. And the root is the nervous system.
Can kinetics also or PT correct any injuries that you might have had to your left side?
Of course. Yeah, of course. And FYI, I'm not supposed to promote the business too much, but you could easily speak to Barbara about our clinic. She knows a lot of information about the office. She's been with us forever. You can also call the office too, all right? But we could talk about that later. You can call me personally. We could discuss it. Right convergence. So the right eye didn't come in. Let's treat you. How's that sound? Now, do you have any pain anywhere?
Right now? No.
No? Do you get any back pain?
Well, yeah, my neck.
Your neck? So if I turn your head this way and I tilt your head back, does that bite you a little bit? Does that hurt? That hurts, okay. Now if I turn your head this way and I tilt the head back, a little bit better on this side.
Yeah, but it still hurts.
Still sucks. Was it on the left side or right side that you felt it?
It's worse on the right side.
It's worse on the right side. Okay. All right. So let's correct the eyes and see if we might be able to elicit a different response. Ready? So we're going to follow my tactical pen with just your eyes. Now, if you just see how she's sitting here, if you notice her head is doing this.
Yeah, it always does.
Okay. That's because if the cerebellum on this side, the balance centers in the body, are dysfunctional or they're hypofunction or underfunction, the head's going to tilt that way. All right, so what I want you to do from here is just going to follow the tip of this. Let me open this pen up like that. I want you to focus on the tip. And from here, you're just going to follow it. Good. You're doing so good. She's getting fatigued already. All right, so we're going to recheck the neck now. There was a couple other movements I wanted to do, but when she started doing this, the eyes started getting tired. So now when I turn your head this way and then tilt it back a little bit, that's better range of motion. How's that pain feel?
It hurts.
Does it hurt the same, better, worse?
Less.
Less. Turn this way and tilt it back. Same, better, worse?
Still hurts.
Same, better, or worse?
A little better.
A little bit better. So give me a percentage of better.
10% better.
Perfect. All right. So now follow the pen again, and then we're gonna come down. Okay, now just follow the tip. It's so tough, I know. Good. Now follow the pen tip again.
Of course,
You're actually not. And then we're gonna do one more thing. I'm gonna turn the head, and then I'm gonna tilt it back. How's that feel now?
a little better.
A little bit better. How much better would you say?
Well, it was better when I just went to the side. Then when you tilted it back, I felt the pain.
Okay. So overall, when you just turn it right to left, it's pretty significantly better.
Yes.
Okay. Now we're gonna tilt it back now.
Better.
Better. Still sucks, right? It's not perfect yet because we haven't fixed anything completely yet, and that's a much better range of motion. How's that feel to you now on this side?
Better.
Better. All right. So let's do another round of this. So just by fixing the eyes, the tone of the muscles of the neck actually decreased. So the tightness of the muscles decreased. Let's work this a little bit more. Actually, you know what? I lied. I'm going to change it up. Can you open up your jaw for me? And close it. Open. Does that bother your jaw at all?
No.
Do you have any pain? Feel that tightness right there?
Mm-hmm.
Compare.
I can't tell.
Now, if I do this, I'm going to massage this, and then I'm going to turn your head this way, and then I tilt it back now. Did that change it? The neck pain?
Well, I'm feeling the pain of you doing that.
Now, how's that feeling to your neck now?
Better.
Better. So by working the jaw, that's a lot better.
Oh yeah.
So when I was palpating her jaw or feeling her jaw, this side clicked a lot, and so when she opened the jaw, it was like. So for her, the jaw is contributing to a lot of her neck pain. Remember, I was talking about feet, eyes, jaw. Feet, eyes, jaw. And for you to get rid of your neck pain, what I want you to do is I want you massaging this. Actually, no, let's have you massage that for a couple of seconds now, for about a minute, as I'm talking to everybody. The jaw. Where it
Oh,
was.
my jaw.
Yeah, yeah, right there. That's what I want you to do. And it's not going to hurt you if you do it. Okay. Are you guys tracking with me a little bit?
Oh, we're going right along with you.
Okay. I try to make it as simple as possible because this is very deep neurology. But if I could simplify in such a way that we could actually understand it and comprehend it, I think then you guys could become proactive in your own health care. That's my ultimate goal. I don't care if you're coming to see me as a patient. I care about you being proactive in your health, whether it's coming to see us or seeing somebody else. But now when you see somebody else, you need to start asking deeper questions. Are they getting to the root or are they just treating the symptoms? Okay, now relax. Now we're going to turn that this way and tilt it back.
Much better.
Much better. And this way and tilt it back.
Oh, that was really good.
Okay. So now once we work on the neck. So your homework assignment, I'm going to give you 2 homework assignments. Number 1. I want you to massage the jaw, like you're just doing. And number 2 is, you're going to grab a pen, and with your left hand, you're going to draw circles going this way. You can take this hand away.
Oh.
So 2 different exercises. You're going to do circles without turning the head. Yep, so eyes stay fixed and forward, and you follow the pen tip. Follow the pen tip. Follow the pen tip. Yeah, that's what I want you to do. That's it. Those 2 exercises. I'm feeling within a week that neck pain's going to be gone. Just do it every day. Okay?
Good.
All right, round of applause. Thank you, Mary.
Very nice.
Any questions? Because we're going to wrap it up. I told you 20 minutes would be what we wanted.
course. It was very enlightening.
Thank you, everybody.
Never bored.
You
Never
never
bored for hours.
We can understand.
I have a question. I can't stand to go barefoot in my apartment.
Yes.
I have very thin, bony feet.
I know, it sucks, doesn't it?
Yeah, it does.
Bony feet are the worst. Yeah. I would say my feet were very sensitive in the past. It took me a while to build tolerance on my feet. Like, I hated going barefoot. My feet always hurt me. And then, because my feet are extremely flat, and I don't have much toe motion, and so it really affected my ability to walk. But over time, my feet got stronger. And there's special exercises I could give you to be able to desensitize the feet.
Oh.
Yeah. Yeah.
I go barefooted all the time. The only thing is you can step your
Yeah, we're going barefoot. That's why we have to. I don't want everybody going barefoot right now. When you come in and get conditions, your feet get conditioned, your body gets conditioned, then you get to be aware of your surroundings a little bit, and then you can start stretching a little bit with barefoot. Any other questions?
Very good.
Oh, I think there's one more. Do you have a question?
Yes. How long takes for the hair test to come back?
It should only be 2 weeks.
Oh, okay.
Do you want me to check? Did you send it in?
I hope so. If you
Okay.
don't want it back.
Okay. I'll digestive issues. And you being a teacher, you probably have secondary teacher insurance. You have Medicare.
Not where I was.
Okay.
When I was in the school system.
Yes. But what's your secondary insurance? Blue Cross?
Something like
Okay, all right. So we can check that for you. All right. But yes, it does. And it works really, really well for IBS. Yeah. Totally. Yeah, who wants to learn more about acupuncture?
I have another question. That's that I should be concentrating.
To answer your question, I don't know. I would have to assess you. I don't know unless, because you might have a left brain dysfunction, where Mary had a right brain dysfunction. So the exercise would be
Well,
completely different.
I have dysfunctions on both sides, but it is worse on the left.
Yeah, it's very common. Yeah, once I assess you, I'll be able to know exactly. I customize, or we customize programs for everybody. So not every program is the same. Acupuncture, what is acupuncture? Acupuncture is in Eastern medical treatment technology or system. How I use acupuncture in our clinic, or how we use acupuncture in the clinic, is actually treating the neurovascular system. So, for example, with IBS, the vagus nerve, who's ever heard of the vagus nerve? Not like the Vegas, woo woo, Vegas! Vegas! The vagus nerve is also known as the wanderer of organs. It innervates the lungs and the heart, allows the heart to beat. It's the relaxation part of the nervous system, where we have a fight or flight response, which is the sympathetic nervous system, and then we get the parasympathetic, which is a rest and digest and recovery. The vagus nerve is the most important nerve in the body to heal any kind of digestive issues, sleep disorders, chronic stress, anxiety, pain, heart and cardiovascular disease. The vagus nerve is it. And there's ways to actually stimulate the vagus nerve using acupuncture. And every time we put a needle in somebody, we're actually working within the neural pathways to be able to inhibit either pain or increase blood flow to different organ systems. And then when we combine that with a hair tissue mineral analysis, we can customize nutritional programs too.
Do you always stay in the room with the patient?
No. No, so I'll needle you, have you relax in the room, have you cook, I say, and then you just relax and recover.
And his beds are heated.
They're heated, and you get free massages.
Oh, okay.
So with all our acupuncture treatments, we give away free massage, 3 therapeutic massage.
Is that because of pain and
I
stuff?
found I broke this leg many, many years ago. This bone plus everything. I can't put my hand and I never walk straight. Can't go down straight. And I do fall, and I fall, believe it or not, I fall backwards.
And you're on oxygen?
Someone else.
You're on oxygen? Yeah.
Now, I haven't started in December I became ill and they put me on oxygen.
Okay.
this has happened a long time ago, but I've been always that I can never walk, that's why I never walk barefoot. And I can't put this foot down
Okay.
straight.
And it looks like the foot swells, right?
The one?
The foot swells.
Yeah, oh yeah,
Yeah.
yeah.
Yeah, there are, we don't do that in our practice, but I might be able to refer you out to clinics that do it. I think lymphatic drainage for you would be really good for you.
It's a little late for that.
No, it's not.
Stop it.
It's not. It's really
No,
not.
I need to walk.
It's not. It's really not.
No, you never know, Mary.
Yeah.
Separate.
Put it this way, there's something known as neuroplasticity. Nervous system plasticity, the ability for the nervous system to change. So it doesn't matter how old you are, you can still learn.
Now, when I'm standing, I find myself, I kind of, if I'm gonna, I feel like I'm gonna fall, and it's always that I'm going backwards
Yes.
rather than forward.
Yes, very common. Yeah, so what I would do is I would train your eyes. I would train your eyes in orientation to your surroundings.
Because I thought there's something wrong with me that I'm feeling dizzy, but I feel like I'm gonna fall.
Yeah, that's very common. It's a part of the brain that actually regulates posture alignment. And so there's different ways for us to access that.
In your opinion, and your knowledge of the body, is there a connection to the weather and your
Oh,
body?
totally.
There is.
Oh yeah, totally.
There is.
Yeah, totally.
I just wanted to, I mean, I know enough that almost everybody will tell you the same thing.
Yeah.
Because
And full
there are
moons.
good days and bad days.
And I see on full moons too.
And full moons.
Yeah,
yes.
full moons. Most of my patients, my chronic pain patients, they feel worse on full moons. My emotional patients do too.
Werewolves.
Can acupuncture actually help stress?
Oh my gosh, yes. Yes, a lot. Yeah, so can acupuncture help stress? Yes.
But where would you put the needles for stress? I mean,
In your body.
I'll put on Barbara. I'll put on Barbara's body for you. Chances are I'll probably put it in the ear, but it also depends on my diagnostics. So I use needling to rebalance the left and right brain. So if I see that you're left brain dominant, I would do needling on certain points in the body to stimulate the opposite side. Yeah. So my thing right now is communicating left brain, right brain.
This was
And-
most informative.
Thank you. And also for physical therapy, we don't need doctor's orders anymore. Yeah. So
show it to you.
for the first 30 days, you can see us. Can I talk about this?
Yeah.
Okay. Okay. You can see us for 30 days without a doctor's order. Okay. So we don't need prescriptions from physicians. However, if we see you, like for example, in your case, I'd love to get a doctor's order for you because you have medical comorbidities and other medical conditions. But most of us in this room, we don't need scripts. If we do come in and you see us and we think something's fishy, we'll refer you out. Yeah, you could use this as a triage where it could take time and weeks to get in to see most physicians. You can see us within a day or two.
Is that after 30 days, what happens?
After 30 days, we'll either refer you out or you're done. So refer you out to get another script or you're done with PT at that point.
They didn't do that. We don't charge them after the 30 days?
If we get another,
Doesn't come out of Medicare?
well, if we keep you as a patient,
Then it
chances
comes
are,
out.
and then we get another doctor, we get a doctor with a prescription for physical therapy, and then we just keep on billing Medicare.
Could that be true? I never had, this was so many years ago, they didn't have therapy then.
Yes.
And I never had therapy. I had it in a cast up to here. And then after they take it off and you walk and that was it.
Yeah,
So could that have been one of my ankles that way that, you know,
could be.
I never
Could be.
had
I don't know.
therapy.
I've seen patients post-op that did really well, and I think that we do a good job with our post-op patients. But yet their bodies are swelled, and so here we are doing the right type of treatment. They had really good surgery, but their bodies just responded with increased inflammation. From where you are today, I don't know. Our bodies are so unique and different.
Yeah.
It's tough to tell, and there's no magic pill. What I talk about is nothing magical. Sometimes we have miraculous results, but it's not a miracle when it's done routinely because it's based on neurology and science.
what is the time frame that one should have 2 times a week, 3 times a week? Is there
Ultimately,
any-
what we found, I love that question. Should you be coming to PT twice a week or 3 times a week? We've used our medical billing system for almost 10 years now. So we have close to probably 400,000 visits in this database. And this company has over 3,000 clinics in it. And so we looked at the data of patients coming in twice a week versus 3 times a week. And on average, patients got better 21.6% faster coming in 3 times a week.
3 times.
Think about it.
That
Like,
would be
it
optimal.
would be optimal. Would it be better to brush your teeth twice a week or 3 times a week?
Yeah.
And especially when we're dealing with the nervous system. 3 times a week typically is the key. Yeah. Twice a week, we will wean you down to twice a week if we notice that Medicare is starting to run out, like your cap is running out. But 3 times a week initially, just hit it hard. Yeah. Same thing with acupuncture. We found that acupuncture 3 times a week, especially when it's combined with PT, much better results than once or twice a week. Because it would consistently change in the nervous system.
How does the acupuncture combine with the PT?
So, say you're seeing one of my physical therapists, say Jamie or Greg, and you're seeing them for PT, then you come over right after and you see me for acupuncture or right before. Yeah, Barbara does it.
Is Gal still there?
No, I miss my girl.
And
No,
Danny?
Danny's been,
Danny's doing acupuncture.
he just graduated.
Fabulous.
Yeah, I miss my Danny.
Oh, fabulous.
Danny, if you're watching, I miss you. Come back to us.
Does Medicare pay for it if you go there without a doctor's note?
Physical therapy?
Yeah.
Yes.
I thought you were having a
Take Clover insurance?
Is that your primary or secondary?
Primary.
We'd have to call. I don't know.
Who calls, I do, or?
No, we call for you. You just call the office. Can I talk about this?
Yeah.
All right. You just call the office and you give them your insurance information and we'll work something out. If it doesn't cover it, I mean, we know you guys pretty well. We'll try to take care of you the best we can. And I think there's a car service that goes directly to our office.
Really?
Yes.
Great.
Yeah.
All right. I'll take a number of your business
Okay.
card.
George.
Definitely. George does?
You were referring very briefly in the beginning of your lecture to nutrition. Worst or most aggravating substance or food that we all should try to avoid?
Oh, I love this. All right, so the question is, what is the most irritating or aggravating food if we eat on a daily basis
Pizza, I hope.
that would irritate us and hurt us? Okay.
Marie says iron.
No, my wife will kill you. Barbara, do you know the answer to this, right?
Magnesium.
No, the food that people eat on a routine basis that could irritate them or hurt them. Wheat. Anything that has wheat in it.
Oh, that's right.
Any gluten or wheat.
Thank you very much,
Yeah.
that's what I do
But wheat bread's no
myself.
good, you're saying it,
Yeah.
right?
Pastas and breads.
Yes. Yeah. So, if you have arthritis, raise your hand. If you have arthritis in the room,
Try what?
if you have arthritis in your room, raise your hand. It's arthritis.
Everybody, look.
Everybody, right? The number one food that irritates arthritic joints is wheat or gluten. Because, yeah. And, what's that? If you have non-gluten food. Yeah, but certain foods cross-react and behave like gluten. Like dairy.
Like who?
Dairy,
Dairy?
corn, soy, high fructose corn syrup, which is in your
Quit eating
sodas.
then.
Yeah.
Stick to hamburgers, right?
Without the bun?
Oh, no, meat.
That's not good either. Not red
Takes
meat.
so long to digest meat. I fish.
How often do you
You
eat?
eat fish?
Every day?
And one food I would suggest adding to your life, liver. Liver. The one food, if I could say, if you eliminate one food and add one food to your diet, liver.
Now, is that beef liver?
Beef liver. No, it doesn't matter, any liver. Chicken liver is
Calf
really
liver is
good.
good, too.
Calf liver.
Chicken liver collects
They
a
said
lot
that's the
of
worst.
bad and that beef liver is the better of the two.
No, the calves, isn't it?
I always heard that was the worst, liver, not to eat it, that was the worst organ.
Yeah.
That's what I always said.
Yeah, because people are fearful of the toxicity, right? All right, let me tell you something. The liver does not store toxins, it filters toxins. Guess where stored toxins are in?
Your kidneys, right?
No,
Red
Where?
meat.
the meat.
Me.
The fats of the meat, that's where the stored toxins are. It's not stored in liver. Liver filtrates it. So guess what? Every time we eat meat, we're eating the toxins of that animal.
Yeah.
All right. So if you're going to go with meat, you want to make sure it's organic and grass-fed.
What about chicken and turkey?
Same thing, organic and grass-fed. It's still stored in the fat.
Wow.
See, people aren't typically fat; they're typically toxic. So if we eliminate the toxicity, people lose weight.
So then what can you eat? A fish?
It's toxic.
Yeah, that's a big question. Most people have. We're going to be touching base again on the nervous system and the vagus nerve, and we'll go into more detail regarding the foods. And then if we do a hair tissue test, which I got to check to see when yours is in, we can figure out whether you're a slow metabolizer or a fast metabolizer, which means that whether you should be on more of a higher fat diet or a lower fat diet. So we customize everything from PT to nutrition to acupuncture. Everything's customized to you.
What time is it?
It's at, do you know what time it is? 6. 6. And we have dinner. So we have dinner there for you. We bring organic foods
This
in.
Thursday or the following Thursday?
The following Thursday. The last Thursday of the month. Okay? Well, thank you, everybody. I appreciate everybody's time. Thank you.
Very good.
Thank you, everybody.